Hello, it's Dr. Patrick Hu from Moffitt Cancer Center. We're really happy today to have Dr. David Joyce, an expert in orthopedic oncology here at Moffitt Cancer Center. Thanks, Dr. Joyce, for joining us today.
Thank you very much for giving me the opportunity to talk.
Today, we're going to talk about hemipelvectomies. So, Dr. Joyce, tell us what a hemipelvectomy is and in what cases this procedure would be used.
So when we talk about hemipelvectomies, we're primarily talking about the pelvis. So that's typically the bones that kind of connect your legs to the rest of the body. The majority of these procedures usually occur in some form of sarcoma. The biggest thing that we talk about with hemipelvectomies is how to reconstruct them. And those can be done with different mechanisms as far as custom prosthesis that we talk with manufacturers. We go through the FDA. And we create essentially a new pelvis and a new hip joint for the patient to allow them to eventually walk on it close to normal.
Can you tell us a little bit about the importance of having a complex procedure like this done at a comprehensive cancer center like Moffitt Cancer Center?
Yep, we can definitely talk about that because these are very complicated procedures. And so we often need other specialties to help remove this tumor in order to get it completely out. Because of that, Moffitt's uniquely situated to be able to take care of all these types of cases where most local hospitals would never even attempt something like this. And even a lot of academic centers won't even be able to handle this because they just don't have the experience or expertise to manage along and get through this. Moffitt, fortunately, with some of the technology we have here is a very unique, even within the state of Florida, and the rest of the country, let alone the world, for some of the things we're able to do for patients that they're not really able to do other places, unfortunately.
Can you talk a little bit about 3D printing and how we're using this technology to assist with hemipelvectomy?
Sure. The benefits to 3D printing in general and 3D technology is it allows now the surgeons to have a better view of the field before they actually have a surgery done. It allows us to then also see if a reconstructive option is a viable option and allows us to kind of plan for this. Also, along with this 3D printing, we typically will use, at least at our institution, at some of the other institutions, but primarily Moffitt, which happens to be on the forefront of this technology, is computer navigation. And so along with this model, both a 3D actually physical model, we can have a 3D model that is in the software, so to speak. So a 3D computer model that is then uploaded into the navigation system in the surgical suite. We can then appropriately mark out our cuts, essentially follow the lines, just cut along the lines and make sure that our 3D printed custom prosthesis will fit appropriately. It does that as well as also make sure we're able to kind of stay within our plan so we stay outside of the tumor to get a negative margin resection.
Tell us why it's so complicated in this area to do surgery. There are a lot of other anatomic structures that you're working around. Is that why it's so complicated to do these procedures?
Yeah, that's probably the biggest reason. So let me elaborate on that a little bit. So typically in the extremity, most everything is within two planes. It's pretty easy to kind of plan that way. It's either distal, proximal, medial, lateral, but within the pelvis, there's a lot of geometry that changes. It shifts over, it's very 3D oriented. It makes it very hard and people have trouble getting tumors out of the pelvis, primarily because of the 3D anatomy that's there that you don't typically see in other parts of the body. Along with navigation, that's actually helped us make cuts in places that we wouldn't have been able to do before. Because we just can't get to the other side. And then you can't safely get to the other side, you can't safely see where you're at. But with 3D navigation or computer navigation, we're able to actually see where our instrument is actually heading, where it stops, where to plan. And when these are appropriate cuts are made, we're able to kind of match in a appropriate custom 3D printed prosthesis.
So what's the future hold for 3D technology? Are we eventually going to actually print the prostheses using 3D printers?
So currently, up until about last year, those of these were machined out. We now have 3D printing prostheses that we are putting in. I've put in 2 of them this past year that are completely 3D printed. They may have some slight machining on the surfaces where the bone is integrated in, but that's about it. And then a new 3D printer is now able to create a porous structure on the edge of the prosthesis that mimics bone in an effort to get bone to actually grow into that area. So we are doing 3D printed custom prosthesis now.
Wow, how exciting. So
Yeah.
besides helping you plan the surgeries, execute the surgeries, educate the patient, you're actually printing the prostheses that are in there and also stimulating the growth of new bone in there through these 3D printed prostheses. How exciting.
Yeah, it's very exciting, and I'm looking forward to seeing how things are going to turn out.
Well, how wonderful. All right, Dr. David Joyce, thanks so much for being here with us today.